Hi, this is Steve Sabludowsky, publisher of BayouBuzz.com, and today we have Dr. Georges Benjamin. He's Executive Director of the American Public Health Association. Good afternoon, Dr. Benjamin. How are you doing today?
Stephen, I'm just great. Good to see you.
Thank you so much. I really appreciate you taking your time, especially at this point in time with Congress really heating up. And obviously our discussion is going to focus in on what is called Obamacare or the Affordable Care Act. And since the president calls it Obamacare, I guess it's fair enough for me to do so also. But let me ask you this. Obviously, your organization is opposed to any repeal of the Affordable Care Act. And I'm just wondering if you could explain to us the reason, the purpose behind the opposition to a repeal.
Well, you know, my organization has been supportive of the fact that we believe that health care is a human right. We're in a country that you get your care based on whether or not you have health insurance or not. Yes, we have safety net systems, but you know, the best way to get care is to have that insurance card. And so we have been strong advocates for universal health care for all Americans since our inception, really. So having said that, we think the Affordable Care Act is a good step forward. It does a lot of things. We know that people die simply because they don't have access to health care. And we think the Affordable Care Act goes a long way to reducing the number of people who get ill without getting their illness fixed and who die. And so that's why we don't think it should go away.
Okay, now our former U.S. Senator Mary Landrieu had stated on radio that the Affordable Care Act actually was a compromise, and she said that quote, liberals wanted all the way to go with giving everybody an insurance card, and so the Affordable Care Act is more of a compromise and within the private sector. I'm just wondering, obviously she's no longer in the Senate, but is it in fact a compromise?
You know, all legislation is a compromise, and the Affordable Care Act is no exception. There are many, many things in that law that was finally passed and signed into law that we would have done differently. We would have certainly had a public option, for sure, in that legislation. We would have certainly wanted to expand Medicaid coverage even higher. We would have probably given greater subsidies. So there are many, many things we would have probably done differently should we have been in control as an association.
Okay, so how do you feel that it's actually, or at least in terms of the public option, do you, that's something we're not going to see, at least in the next couple of years, next 2 years, and that is because Republican control of Congress. Right now, the real concern for many is the possible repealing. Now, Congress, at least the House of Representatives, just I think for the 56th time, is it, or somewhere around that number, has just passed to repeal the Affordable Care Act, Obamacare. Is there anything different with this particular effort?
No, there's nothing different. The House has been repeatedly doing ceremonial votes. They're now at their 56th vote. You know, the president's going to veto that vote. They do not have the votes to override it, assumingly they can get it through the Senate as well. You know, the fact is, at the end of the day, Americans should have comprehensive access to affordable health coverage. The Affordable Care Act has done that for millions of Americans, and it's too far. We're not taking this away.
Okay, now the biggest, there's quite a number of beefs about the act. Number one is the cost. And if we have a public option, then wouldn't that actually be a greater cost to the United States and the taxpayers?
Well, not necessarily. A public option would have probably given more competition and may have actually brought costs down. You know, the Medicare program is administratively far less costly than private insurance. You know, I happen to have private insurance, and my company and my members and my staff certainly have access to private insurance. Having said that, Medicare, which all seniors love, and I'm getting near that age, and I'm going to love it too, is in essence a national public option, and we all love that program. You know, if my organization had its way, we would do Medicare for all. Now, we didn't get that, and the public option would be much more competitive. But I can tell you that for many, 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 many more Americans, the insurance that they actually have to pay out of pocket under the Affordable Care Act is much cheaper than it was, 3 years ago.
Okay, now I've been hearing, and please help me, because I agree with what you're saying, that for many Americans the insurance is actually cheaper. However, down here in Louisiana, I think many of the voters feel just the opposite. And I think that's one of the reasons why Mary Landrieu is no longer in the U.S. Senate. And from what I am hearing, at least from them, who have staunch opposition, is that their premiums have increased double, triple. I've asked those people to please send me the information so I could see exactly and corroborate. So, you're saying for many, many, many
have
people.
They done that?
No. They have not. Not that I would expect them to. But what is reality, though? I mean, is reality for everybody a lot lower insurance premiums, or is it a whole lot higher, or is it a combination of both?
It's a combination of both. And so for the vast majority of people, their insurance premiums are less. And even if the premium went up, if you're eligible for a subsidy, your out-of-pocket costs might be lower. Some people you're paying the same. And remember that two things are also going on in Louisiana. Number one, you did not expand Medicaid. And number two, you have a federally run, basically, health exchange. So, you have a system that doesn't have one where everyone is in and no one out. In a system with everyone in and no one out, certainly costs are going to come down. If you have a very robust health exchange where you have lots of health plans competing the American way, then your costs will come down. So, when you have these bifurcated systems and people do the cherry picking that they often do to make their arguments, then you can't often get to the truth. Well, the truth is, yes, there's some variation in costs, but overall, most people are paying far less out of pocket than they did before the Affordable Care Act.
Okay, also another complaint is that the health costs actually are increasing, and directly because of Obamacare. Could you address that, please?
Well, actually healthcare costs at a national level are actually greatly slowing. Now, costs always go up. We always have inflation. In every part of our economy, inflation occurs, but inflation is occurring much lower than it has been during the Obamacare years. Now, having said that, how much of that's due to Obamacare and how much of that's due in the recession, I don't think anybody really knows, but it's probably due to both.